Hi everyone, and in this video I'll be discussing adverse drug effect. Until now, what we discussed in pharmacodynamics is that when we give a drug, we see the responses, we see some good effects. But when we give a drug to a patient, there is a chance that we see the bad effect also. And the bad effect, what we are going to learn is adverse drug effect. What is the literal meaning of this adverse drug effect? It is unintended or undesirable consequence of drug administration. So let me write what is adverse drug reaction. It is nothing but the undesirable. We don't want that, or unintended. So doctor doesn't want to have that adverse effect. Consequence of drug administration. So that is called adverse drug effect, or in the future I'll be telling it as adverse effect. In that we need to understand certain terms. The first one is the side effect of the drug. What do you understand by side effect of the drug? Let me take an example. Example is phenyramine. Now what is phenyramine? It is an antihistamine. So it is a H1 blocker, or what we call it as antihistamine. Now because it blocks histamine, it is used in the treatment of allergy. So we use it to treat allergy. You know that histamine is a mediator of allergy and we block it. But same phenyramine will cross the blood-brain barrier and it blocks the histamine receptor in the brain, and in the brain, that is in CNS, it causes sedation. The reason why it produces sedation in the brain is it blocks the action of H1 in the brain. Histamine is required for wakefulness in the CNS, and when you block it, there is sedation. Now, what dose did we give? We give the normal dose. Normal dose. Is it because of the drug? Yes, it is because of the pharmacodynamic action of the drug. Is it produced directly by the drug or indirectly by the drug? Obviously, it is directly by the drug. So, if all the three are S, then we call this problem or adverse effect as side effect. So, it should be used at normal dose. Should be an extension of pharmacodynamic action, and it should be directly by the drug. Now, moving on to the second important adverse effect. It is called as secondary effect. It is called as secondary effect. Now, what do you mean by that? You all know corticosteroids. Just now, we underwent pandemic situation and we use steroids. But when you use steroid, the steroids are also known to produce immunosuppression. So when they produce immunosuppression, what happens? There is a chance of opportunistic infections. Opportunistic infection. Now, please tell me, corticosteroid, will they produce infection? No. They produce immunosuppression. Because of that, there is opportunistic infection. I'll give one more example. When we use corticosteroid, they are having anti-inflammatory effect. So they suppress the inflammation, and we know that inflammation is required for wound healing. So when you use steroids, there is poor wound healing. Now, are we using a steroid at high dose or normal dose? Obviously, it is. We use the steroid in normal dose. And is it directly by the drug? No, it is indirectly by the drug. So when do you call secondary effect? When the dose is normal and it is indirectly by the drug. So corticosteroids, they produce opportunistic infection not directly by causing immunosuppression and later producing the opportunistic infections. Do they cause poor wound healing directly? No. They will have anti-inflammatory property and because of that they will produce poor wound healing. I'll give you an example one more. Tetracyclines. Tetracyclines are antimicrobials which are called broad spectrum and they kill the microbes. So when they kill the normal flora in our gut, they kill the normal bacteria in our intestine. What happens? The pathological bacteria proliferate and patient complains of diarrhea. So tetracycline causing diarrhea is a secondary effect because it directly doesn't cause it. It kills the normal flora, the pathological flora grow up and they cause diarrhea. So please understand the difference between the side effect. It is directly by the drug, normal dose. Secondary effect, directly by the drug, no. It is indirectly by the drug with a normal dose. So once we understand the secondary effect and side effect, the third important adverse effect we need to understand is toxicity. The drug toxicity. The drug can produce toxicity. For example, it can produce acute toxicity or chronic toxicity. Classical example of acute toxicity is when we use paracetamol at high dose. Paracetamol, when it is used at high dose at one time, it can cause toxicity to the liver and we call it as hepatotoxicity. That will lead to hepatotoxicity. Chronic, I'll take an example of an anti-malarial drug, chloroquine. So when you use it for a very long time, it can cause damage to the retina and we call it as bull's eye maculopathy. So they can damage the organs and cause toxicity. So the toxicity can be acute or chronic. So toxicity can be acute or chronic. Either the dose is increased, higher dose. So toxicity occurs because of higher doses. You compare side effect, it was normal dose. Secondary effect, normal dose. Toxicity is because of increased dose or use the drug for a very long period. Now, number 4, there is a concept called drug poisoning. Drug poisoning, what is the difference between toxicity and poisoning? Both look similar. Poisoning means patient has immediate danger to life. So patient has immediate danger to life, that is lethal. If you don't treat the patient, patient will die. Yes. So any poisoning, for example, organophosphate poisoning, any poisoning, there are certain basic principles. What are the principles in managing any poisoning? Number 1, always maintain the airway, breathing and circulation. Remove the person from the contact of poison. That is number 2. So patient should not be in touch with the poison or he should not be taking it. Number 3, you have to do gastric lavage. Suppose a patient has taken orally. So you have to do gastric lavage. What is the reason? To remove the unabsorbed poisons. And usually gastric lavage should be done within 6 hours. After 6 hours, no use because it would have been absorbed completely. Otherwise, you have to find out an antidote. To neutralize the drug, you have to find out the antidote. For example, for OP poisoning, we have an antidote called atropine. For morphine, we have an antidote called naloxone. Suppose many a times we may not have antidote, then you have to excrete the drug out. Excrete the drug. So how do you eliminate the drug out? Number 1, we use a machine called dialysis. So we can dialyze and remove the poison, or you can change the pH of urine. Change the pH of urine. And you know the general pharma. If the poison is acidic drug, what do you want to do with the urine? Make the urine pH alkaline. If the Poisoning is alkaline drug or a basic drug. What do you want to change the pH? Make the urine pH acidic. So this is the basic principles what we take care to manage a case of poisoning. Many a times there are certain poisons where dialysis is not useful. So let us make a list. Dialysis not useful in following poison. So dialysis not useful in following poisons. So the mnemonic for that is better, care, avoid. So please read the mnemonic carefully. You should not do dialysis. Even though you do dialysis, you are wasting the time. It's not useful in this poisoning. What are those? B for the benzodiazepines, BZD for benzodiazepine, the name is diazepam. Now the reason is this diazepam has high plasma protein binding. And in general pharma, we have discussed that a drug with high plasma protein binding, you cannot do dialysis easily. Then moving on to the other drugs, C for chloroquine, an anti-malarial drug. A for amphetamine, a sympathetic drug. V for verapamil, and verapamil is a calcium channel blocker. O for OP, that is organophosphate poisoning and opioid poisoning. Then we have imipramine. Imipramine is a tricyclic antidepressant, and D for digoxin. Now why we cannot do dialysis in this poisoning? Because all these drugs what we have mentioned, if I want to correlate with general pharma, they have high volume of distribution. That means they don't stay in the blood vessel and they stay outside the blood vessel, and if they stay outside the blood vessel, it's very difficult to remove them by dialysis. So dialysis is not useful in this poisoning. Better care, avoid benzodiazepine, chloroquine, amphetamine, verapamil, OP, opioid, imipramine, and digoxin. So we understood toxicity, we understood poisoning. Next important aspect, the fifth one, when you give a drug, it's a foreign substance. We call it as xenobiotic. So that can cause drug allergy. So when you give drug to a patient, it can cause allergy, and all the types of hypersensitivity can be seen, but the most important hypersensitivity is type 1 hypersensitivity reaction, and a patient may end up with anaphylactic shock. So can you tell me one drug which comes to your mind which can cause anaphylaxis? Yes, the name is penicillins. So they can cause anaphylaxis in certain people, not everyone. The next one is type 2 hypersensitivity reaction. Example is the halothane. Halothane causing hepatitis. We call it as halothane hepatitis. Type 3 hypersensitivity reaction. Classical example is the drug lamotrigine. The drug lamotrigine causing Stevens-Johnson syndrome. Type 4, the delayed hypersensitivity reaction, is produced by clonidine. Clonidine is applied as transdermal patch. So TDP stands for transdermal patch, and that patch can produce contact dermatitis. Now in all these drug allergic reactions, the first one is very, very important, that is anaphylaxis. Patient may die also. That is why it's very important before administering this drug, you have to give a test dose and no allergic reaction, then you can give the drug. So very, very important is anaphylaxis. What is the drug of choice for anaphylactic shock? It is adrenaline 1 in 1000 IM. The next problem that can happen when we use a drug is photosensitivity. Now, what do you mean by photosensitivity? Suppose a doctor prescribes a medicine, a patient took the medicine and went in sunlight. Now, when the sunlight falls on the skin, it may react with a drug or drug metabolite and causes rashes everywhere. And that is called photosensitivity. I will give an example of drugs. For example, the fluoroquinolones such as sparfloxacin, then tetracyclines, they can produce photosensitivity. The meaning is simple. After taking the drug, patient should not get exposed to direct sunlight, otherwise they may have rashes in the skin. The seventh one is idiosyncratic reactions. So idiosyncratic reaction, what do you mean by that? Now we all know that when we give a sleeping tablet for someone, they should sleep. But some people, if I give sleeping tablet, they become excited more. And that is called idiosyncratic reaction. That is seen in certain people only. And that's why it has the genetic basis. It has genetic basis. For example, the sleeping tablet like benzodiazepines, they should produce drowsiness, but they produce excitation in certain people. That is called idiosyncratic reaction. Not in everyone, some people. One more drug is chloramphenicol. When we give it to certain people, they develop a problem called aplastic anemia. That is idiosyncratic reaction. Number 8, patient may develop disease from the drug. So it is called drug induced, or it is called physician induced, or iatrogenic adverse effect. Now, how can a doctor give a disease? Let us take an example. A patient comes with he has knee arthritis. Let us take the example of patient has knee rheumatoid arthritis. Suppose the patient is given NSAIDs. NSAIDs can cause gastritis or peptic ulcer disease. So the doctor had given the drug for rheumatoid arthritis, but patient suffered with gastritis. So how do you avoid it? Give along with that PPS. Or patient is given corticosteroids for a very long time, so they can cause osteoporosis. So this is called the drug induced or physician induced or iatrogenic adverse effect. The next important one, when we use a drug, the drugs can produce carcinogenicity. They can cause cancers in the patients. Classical example, when we use a drug by the name procarbazine, an anti-cancer drug, it can lead to secondary leukemias. So a drug can also cause cancers. Then we have a very important one. The name is teratogenicity. Very, very important. What do you understand by that? The meaning is simple. When I give a drug is taken by pregnant women. It is taken by the pregnant woman. When the pregnant woman takes it, the drug crosses the placenta. When it crosses the placenta, it will reach the fetus. Now when it reaches the fetus, in the fetus it can produce congenital malformations. It can produce congenital malformation in the fetus. And that is called teratogenicity. So when we give a drug, it is taken by pregnant women, it crosses the placenta, enters the fetus and produces congenital malformation. We all know that in pregnancy we have three trimester, the first, second, and third trimester. First trimester is the one where the crucial organogenesis occurs. So they can ask in the exam, when you prescribe a drug to a pregnant woman, which trimester is highly crucial? Is first trimester because organogenesis occurs there and most of the congenital malformation can occur in that first trimester. So very, very important. So that is fine. But how will I know a drug is teratogenic? Where do I get the information? Now the risk of teratogenicity, teratogenicity risk is given by US FDA. US FDA stands for United States Food and Drug Administration. They have given a risk category. How do they decide? They decided based on human study and animal studies. So they decided it based on human and animal study. Whatever data they have obtained, from that they have categorized the drugs like this. So what is the category? So we call it as US FDA category. Okay, let me write that. Category A. These drugs are very, very safe. You can prescribe to the patient. Now, category B drugs are safe. C may be safe. Why we are telling may be safe? We don't have adequate data to tell its safety in pregnant women. D not safe. And X, they have the high risk of teratogenicity, high risk of teratogenicity, and these are contraindicated in pregnancy. Avoid contraindicated in pregnancy, absolutely contraindicated. So if you see the categorization A, B, C, D, X, the safer ones are A, then B. Example I will give very safe, the folic acid, levothyroxine. Category B, I will give an example, paracetamol. So they can ask in the exam, category A, B, C, D, X belongs to what? It belongs to pregnancy teratogenic risk category. Now let us understand what are the drugs which have risk of teratogenicity. So the teratogenic drugs. So I will be giving you the most important teratogenic drugs with the highest risk. Example, we all know the classical example of thalidomide. So thalidomide was used for morning sickness, but when the babies were delivered, they had a short upper and lower limb, and we call it as phocomelia, or we call it as the seal limb deformity. The other drug what can produce teratogenicity is warfarin. We call it as fetal warfarin syndrome, or it is also called as Contradi syndrome. So don't worry, I have discussed that in detail in the respective topic. Now I am just giving you the list. Now we have anti-epileptic drugs. What are the anti-epileptic drugs which are teratogenic? Phenytoin. Phenytoin can produce fetal Hydantoin syndrome. Then we have carbamazepine, which can produce neural tube defects. Then again we have valproate, which can also produce neural tube defect. What are the major antimicrobials you need to keep in your mind? Antimicrobials. Antimicrobials, we have aminoglycosides, which can cause damage to the ears. Then fluoroquinolones, which can cause damage to the cartilages. Tetracyclines, which can damage the bones and teeth. Apart from this, we have a CNS drug, lithium, which causes serious defect, and that is Epstein's anomaly. And an endocrine drug, misoprostol. Misoprostol, usually we don't use it in pregnancy because it causes abortion, but sometimes if it is used, it can produce Mobius syndrome. Now, one more important drugs which are asked in the exam in endocrine is the use of diethyl stilbestrol. So diethyl stilbestrol is an estrogen preparation. If you are using it in a pregnant woman, if the baby born is a girl, and in the future life the baby will have the risk of vaginal adenocarcinoma. Then we have the thiamides. In thiamides we have the carbimazole and a drug called methimazole. So what can they do? They can produce the scalp defect. They can produce the scalp defect. Then we have the retinoic acid or isotretinoin. So vitamin A high doses should be avoided. So these are the major important teratogenic drugs, and also you can include anti-cancer drugs. Obviously, anti-cancer drugs should never be given to pregnant women because they stop the multiplication of cells. NSAIDs like indomethacin. What can indomethacin do? It can cause premature closure of patent ductus arteriosus. One important CVS drug you should remember, the ACE inhibitor or ARBs, angiotensin receptor blockers. Now they can produce renal agenesis, so they are avoided in pregnant. Very, very important. Very, very important. So I have given most important teratogenic drugs and they have been asked repeatedly. So what I suggest is you read the systemic pharmacology once and again come back to this list and make your notes, because you will get information from there, and this is the list here. So thalidomide, the first drug, warfarin, anti-epileptic drug phenytoin, carbamazepine and valproate, antimicrobials, aminoglycosides, fluoroquinolone, tetracycline, lithium, misoprostol, diethyl stilbestrol, carbimazole, methimazole, isotretinoin, anti-cancer drug, indomethacin, ACE inhibitor or ARBs. So these are the teratogenic drugs. Once we understood the teratogenic effect, one more adverse effect what we see with the drugs are the drugs can produce dependence. So patient may depend on the drug. For example, patient may depend on opioids. So we'll discuss that in opioid topic. Patient will have dependence on tobacco and then alcohol, benzodiazepines. So these dependencies we'll be discussing in the respective topics. So until now what we discussed is the adverse effect of the drugs. So number one side effect, normal dose directly by the drug. Secondary effect, normal dose indirectly by the drug. Toxicity maybe because of higher dose. Normal dose also causes toxicity if you are using it for very long period. Poisoning, I told you the basic concept and I told you where to avoid dialysis, better care avoid. Then we discussed idiosyncratic reaction, drug allergy. In drug allergy, most important is anaphylaxis, that is type 1 hypersensitivity. Then physician-induced disease or iatrogenic disease. Most important is teratogenicity. And we have a pregnancy risk category A, B, C, D, X based on human and animal study. D and X, better to avoid them. And highest risk is with the category X drugs. And I given a list of teratogenic drugs and then dependence. The last important thing what I want to discuss here is a program called pharmacovigilance. So there is a program called pharmacovigilance. What do you mean by pharmacovigilance? Pharma means drug, we all know that. Vigilance means to keep an eye on, to keep a ion. The meaning is vigilance means you have to monitor, that's it. Now why should I monitor the drug? Because drugs produce adverse effect. If I don't stop the drug, patient will suffer. And drug-induced adverse effect is a major problem nowadays across the globe. So that's why it's very important. What is the aim of pharmacovigilance? Is to monitor adverse effect of drugs. That is pharmacovigilance. Now there is a program in India and that is called Pharmacovigilance Program of India. It's a national program and that's the reason it can be asked. So P for pharmaco, V for vigilance, P for program of India. Now why this program is very much important? The program is important because we know that thalidomide tragedy happened and most of the babies born with the phocomelia or C-limb deformity. Second, we recently got certain adverse effect, for example, rosiglitazone increased cardiovascular deaths. So because of that, we stopped the rosiglitazone usage nowadays in India. Now how this was successful? Because pharmacovigilance is a program which depends on these important aspects. So it is required for detection of adverse drug reaction, then assessment of the adverse drug reaction, understanding why it is happening, and then preventing the adverse effect. So the pharmacovigilance detect if there is adverse effect, they have to detect and assess whether it is because of the drug, understand why the drug is producing it, and if the drug is producing, if you are confirming, then prevent it so that the future generation will not suffer. So every medical college, there is a workflow for this. Suppose any adverse drug reaction occurs. ADR stands for adverse drug reaction. So there is a form for that. So there is a reporting form. You have to fill the form. Who can fill? Anybody can fill. Doctor, nurse, dentist, even the patients can fill that. And that is going for one more center, that is regional ADR monitoring center. Usually nowadays, this regional ADR monitor center is nothing but medical colleges. So we call it as AMC, ADR monitoring center. So from that they will report online nowadays. So there is a software for that. The software which is used for that is called Vigiflow. And whatever data which they obtain, there is a database and that is called Vigibase. Now from regional, where does it go? It goes to the National Pharmacovigilance Center. National Pharmacovigilance Center. And where is it located? It is located in Ghaziabad. So it is Indian Pharmacopoeia Commission. IPC stands for Indian Pharmacopoeia Commission and it is present in Ghaziabad. Now once all the reports come to the national center, from there it will go to the worldwide center and that is present in Sweden. It is called Uppsala Monitoring Center and that is present in Sweden. Now once the report is gone to the Uppsala Monitoring Center from various countries, for example, we discovered a new drug for COVID-19 and some adverse effects started coming, and what we do is we give the instruction to the physicians. So this drug can produce this adverse effect, please monitor for that. Or if the drug is producing some serious adverse effect, we tell the physician stop it. We tell the hospitals to stop it. So this is a very good workflow so that the killing of patient due to drugs can be stopped. Because drugs not only produce acute adverse effect, chronic adverse effect is also seen with these drugs. That is why This pharmacovigilance is very, very important, and you have pharmacovigilance exercises in second year also. Now, similar to drugs, do we have vigilance for other things also? Yes, we have vigilance for material. It is called materiovigilance. Suppose we are putting a stent and stent had some problem, and you have to report that also. Hemovigilance. What do you mean by hemovigilance? Any adverse effect due to blood and blood products. If you are transfusing the blood and some problem occurs, that has to be reported. And then herbal vigilance. Herbal vigilance, nowadays people are using herbal drugs and some adverse effect occurs and it may not be reported at all. So this will also take care of that herbal vigilance. So these are the recent trends, what is happening in pharmacovigilance. So in this video, I try to explain to you what is adverse drug effect and what are the different terminologies. Please focus on teratogenic and please focus on the list of drugs and pharmacovigilance. Thank you all.